Hello, my name is Danielle Rodriguez, and I chose to do my presentation on febrile seizures. I chose febrile seizures after a 21-month-old baby suffered from one and the parents needed more information. It started at night when the baby had a fever of 100.7. The parents gave him Motrin, the baby was fine, and they went to sleep. The next day, the parents had to go to work, and the mother gave him Motrin and she left for work. The next day, around 2 p.m., the mother spoke to the grandmother, and the grandmother said that the baby's fever was at 102. She gave him Motrin, and the mother left work to take the baby to the doctor. By the time they reached the doctor, the baby's fever was 102.9. He was very lethargic, and he even slept through that while they drew his blood. They left the doctor, and not even 5 minutes later, the mother turned around to check on him in the car, and he was having a seizure. She didn't know what to do, so she called 911 and an ambulance came and took him to the hospital. When they arrived at the hospital, the baby's fever was at 105.2. After the seizure was over, he was very lethargic and they couldn't even get him to open his eyes. The parents have never felt so helpless and scared. They were amazed at how fast his fever had gone up. This was something that they felt they needed to know more about in case it was ever to happen again. In this presentation, I will discuss what a febrile seizure is and the symptoms that accompany it. I will also discuss what should be done in case the child is having a febrile seizure. Knowing the facts and being prepared is a parent's best defense. Febrile seizures are convulsions brought on by fever in infants and toddlers, ranging in ages from 6 months all the way up to 5 years of age. Children rarely have a febrile seizure before 6 months or after the age of 3. Febrile seizures most commonly infect toddlers. The older the child is when they first experience a seizure, the smaller the chance of them having another one. Febrile seizures cannot be prevented or predicted. However, these seizures occur when a child's temperature rises too quickly. Febrile seizures usually occur when the temperature reaches 102. 1 in 25 or 2 to 5% of children will suffer from a febrile seizure in their lifetime. 1/3 of children that experience a febrile seizure will have another one. The older the child is when they experience a febrile seizure, the less likely they will have another one. However, most children that do experience a febrile seizure will outgrow the seizure by the age of 5. Febrile seizures may be accompanied by one or more of several symptoms. The first is the most common symptom, which is convulsions, which is shaking of the body violently. Convulsions can range from moderate to severe and may affect the whole body or just part of it. This seizure will usually occur when the child's fever reaches 102 or greater. However, this does not mean that the temperature cannot be lower for the seizure to occur. During a febrile seizure, a child may vomit or bite their tongue. Other common symptoms of a child may experience are loss of consciousness, difficulty breathing, they may even stop breathing altogether and start to turn blue. Child's eyes may also roll in the back of their head. A child may also cry during a seizure and usually will not respond to a parent's voice. The severity of the seizure differs in each child. After a child has a seizure, they may be very lethargic and want to sleep, or they may even run around the house as if nothing happened. The way each child reacts after a seizure is as different as they are. Febrile seizures are different than tremors that a person experiences when they have a regular fever. However, the movement is the same movement as a person having a grand mal seizure. If a child having a seizure, the caregiver may want to follow some simple but very helpful steps in order to prevent additional injury to the child. The most important thing is for the parent to remain calm. Don't try and restrain the child. Just stay close to them and monitor them and to comfort them. First, the child should be placed on their side on the floor in order to prevent them from falling. The child should then be turned on their side or on their stomach in order to prevent them from choking. Also, loosen any tight clothing. Remove any hard or sharp objects near the child. And never put anything in the child's mouth. Objects placed in the child's mouth may break off, and they could choke on them. After a child experiences a febrile seizure, a parent should either call 911 or bring the child to the nearest emergency room. The first febrile seizure can be very scary for parents. Most parents think their child is dying. If a parent is not prepared by knowing the signs and symptoms and does not know what to do in the event that the child is having a seizure, it can make them feel very helpless. Parents should be prepared, since there is no way to detect when a child is going to get sick and possibly have a seizure. By the parents knowing what to do in the event the child is having a seizure, it will prevent the child from having any additional injuries. This is a picture of what a child can look like while they're having a seizure. The body may shake violently, and the parent should definitely call 911 in the event that the child is having a seizure, or the child should be taken to the nearest emergency room. Next, I will answer any questions.
I have a couple of questions. Is a febrile seizure harmful? If so, does it cause brain damage?
No, research has shown that febrile seizures are harmless, and there's no evidence that the seizure itself causes brain damage. Children that experience febrile seizures grow up to have normal school achievements.
Is there any way to predict when and if a child is going to have a febrile seizure?
Unfortunately, there is no way to predict if a child is going to get sick with a fever and possibly have a febrile seizure. So the best thing to do to try and prevent the seizure is to keep the fever down. Give the child Tylenol and or Motrin.
Are there any certain infections that cause febrile seizure, or is it just brought on by a common cold?
There are several types of infections that can cause a fever. The most common are ear infections, roseola, or viral infections. Less common infections of the brain and spinal cord, which include meningitis or encephalitis. Certain childhood vaccines have also been found to cause febrile seizures. The first vaccine is the Pro-Quad. This is the 4-in-1 vaccine for measles, mumps, and rubella and chickenpox. Other childhood vaccines have also known to cause febrile seizures, which is the DTP. This vaccine has since been replaced by the DTAP. Thank you and have a good day.